Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Back to school season is here, and that means getting the kids back on a sleep schedule, buying school supplies, and making all of those doctor's appointments. I know it's very confusing. Who needs a sports physical? Who needs an immunization form? Who needs a school entry form? Which grades do you need to submit them for? And what are they even called? I'm here to help you navigate and get the kids back into school and acclimated and ready for the new year on this next episode of Ask the Doc. I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics. Welcome to Ask the Doc, a show where we encourage you to send in your questions and I'll answer them in real time. Today, we're going to discuss vaccines and boosters and all things related to back to school. So let's get started. Looks like we have a question coming in from Marcy. Dr. Constant, we have 3 kids, Susie, who's 5 years old and headed to kindergarten, Matthew, 11 years old and our high schooler, Priscilla, 16 years old and ready for her junior year. I know they're all going to need vaccinations before school starts, but which ones? Marcy, that's a great question. And yes, as your children are various ages and going into various grades in school, there are different vaccines that they'll need. And to be clear, they all require boosters. So let's start with your youngest, for example. That would be your 5-year-old. For kindergarten, the schools require that all children have their booster vaccines from the vaccines that they got as infants. And that includes your DTaP, your polio, and your MMR and varicella. Okay, Marcy. So let me answer your question. It gets a little bit confusing because while the schools require proof of vaccination by a certain grade, but in the medical world, we actually administer those vaccines at certain ages. So to clarify, kindergarten, you require your booster vaccines. That's your DTaP, your measles, mumps, rubella, which is commonly known as the MMR vaccine, your polio, and your chickenpox. Now, those vaccines are typically administered at the 4-year well child checkup. So when you're registering your child to go to school, be sure to check your child's immunization status. Call your doctor's office and just clarify, but your child likely has their vaccines. All they need is the immunization record. And of course, their annual checkup. Now, for example, for your middle child, which is going into middle school, by age 11, your child needs to receive the human papillomavirus vaccine, HPV or Gardasil, the meningococcal disease vaccine. So that's going to be your meningitis vaccine, and then your Tdap booster vaccine. Again, those are administered at age 11 at your 11-year-old well child visit. Now, the school requires proof of that vaccination to enter the 7th grade, which at that point, your child is usually 12 years old. So it gets a little bit confusing. So to be clear, those 3 vaccines are administered at age 11. And then finally, for your high schooler, you have the second meningitis vaccine. So that's the booster vaccine from when you were 11. So at 11, you get a meningitis vaccine. And at 16, you get the booster 5 years later. And you also get the very first meningitis B vaccine, and that's at age 16. Now, to clarify, when you enter high school in 9th grade, they require proof of vaccination, but you don't necessarily have to have those 2 meningitis vaccines because they have those 2 boosters because they haven't been indicated yet. And with the flu vaccine, that's usually offered every year every single year, but we do recommend you get the flu vaccine between September and October. We actually in the pediatric office don't even receive the new flu vaccine until sometime after school starts. By the end of August or so, that's when the new strains are ready and we receive the vaccine. So we really don't start administering the flu vaccine until September, October, which is right before the beginning of flu season. I hope that wasn't too confusing, and I hope that helps, Marcy. Let's take a look at our next question. Our next question is from Marco. Hi, Dr. Constant. My son Miles is getting ready for his first year of high school, but he's not the world's greatest sleeper. How much sleep do kids and teens need? Well, I will tell you, Marco, that most teens are not good sleepers, and that is to be expected with all of the changes during adolescence. They're excited, they're interacting with their friends, they have a little more autonomy, so they're staying up late. Not to mention a lot of them are involved in sports and physical activities, and they stay out late. So that's understandable, but you really do have to talk to your son about creating a schedule at home and having boundaries as far as bedtime. And to answer your question, teens still need anywhere from 8 to 12 hours of sleep, but truly 8 to 10 is ideal. And so you really do need to encourage your son to stick to a routine. And if we know that he has to wake up early for school, then we really need to establish a bedtime that's reasonable so that he can achieve the adequate amount of sleep before school. Good luck. So here's a question from our Facebook website, and that's coming from Matilda. Hi, doctor. My sweet daughter, Savannah, is something of a nervous Nelly. She's transitioning from elementary to middle school, and she always gets a little apprehensive when changes occur. How can we as parents help Savannah manage her anxiety? Well, I hope that video helped. And to answer your question, a lot of times our children have anxiety because they're anticipating a big change. And I think the best way to help them with this anxiety and this anticipation is to really prepare them and talk to them about it long before the event. And that means bringing her by the school, showing her this new school that she's going to attend. If it's possible, even meeting her teacher beforehand. Or if you know a friend or a student or someone that will be in class with her or at the same school as her, you can actually have them come together and talk about the experience and get excited for it and prepare and make this a positive experience. Try to encourage your child and really emphasize the fact that change is good. Change does not have to have a negative connotation. So if we explain that change is good and we're moving on to bigger and better things and we're going to learn and have a whole new adventure, that puts more of a positive spin on what's going to happen. And like I said, I think you really need to talk to her about it and get her prepared and get her acclimated with the area. Even go through the route to go to school, whether you're driving, riding a bike, or walking to school. She can do that as kind of a test run and just get really used to the idea and comfortable with the change that is coming. I hope that this helps and good luck in the fall. It looks like we have another question. Dr. Constant, every year it's the same thing. The twins, Jonah and Aaron, pick up a bug or the flu at school and infect the whole family. What are the best ways to prevent these illnesses both at home and at school? So, there are a lot of ways that we can prevent infection. And of course, during the pandemic, we all heard time and time again how we needed to wash our hands and protect ourselves and use proper hygiene etiquette. And this holds true for all viruses. It's not exclusive to COVID. So it is very important that we keep those routines in play that we learned during the pandemic. And I will say this, it's difficult at school because of course your child is exposed to many other students with other viruses, and sometimes it's not that easy to prevent. But at least at home, I will say we have to remember as parents to not eat after our children or share a drink with them. I think at home, everybody's a little more relaxed. We're all a family and we can drink from each other's cups, or you want to take food from your child's plate. I know time and time again as parents, when we're getting our kids' plates and they still have leftover food and you don't want to throw it away, you take a bite here and a munch there. And that's how we can get infected. So I think at home is a little more risky because we're a little more relaxed. So we have to remember those things and keep them in play. Sometimes your child is not symptomatic yet and they're carrying a virus and they're not showing it yet, and then you catch it before they even show symptoms. Here are a couple other tips that I think you should keep in mind in order to prevent infections. Number one, of course, we always remember we have to wash our hands with soap or hand sanitizer. And you really want to encourage your child to wash with soap and water for at least 20 seconds. Number two, you want to make sure that you teach your children how to cover their mouth when they cough or sneeze. I call that the Dracula sneeze, where you sneeze into the crook of your elbow rather than into your hand. If you sneeze into your hand, then you have to get up and go wash your hands with soap and water again. Number 3, we want to make sure that if our child is showing any symptoms of a cold, whether it's a runny nose, a cough, or a fever, you really want to keep your child at home. Even if you control the symptoms, that does not mean that the virus has now been eradicated. So what that means is if your child has a fever and you give Motrin and they no longer have the fever, that does not mean they are no longer sick. It just means that the fever has subsided with an antipyretic. So please keep your child at home while they are showing symptoms of an illness. Number 4, you want to make sure you disinfect all surfaces that have been exposed or touched by a child that's sick. So that's door handles, that's countertops, the fixtures of your faucet. So you want to make sure you really disinfect and keep the area clean. Number 5, please get vaccinated. Vaccinations are important for specific diseases, absolutely, but they are also important because they boost the overall immunity. So what that means is while you are getting a vaccine that's targeted against polio, for example, or the measles or mumps or rubella, you are also jumpstarting your immune system and have an overall more robust defense system, and that is very important. And our final tip, number 6, is you want to practice healthy habits. You want to make sure your child is getting adequate sleep overnight, that they have a well-balanced diet during the day, they're actually physically active. These are all things that keep us healthy, that boost our immune system, and that help us fight off viruses. So I hope that that helps. Okay, so we have another question coming in from the All Health TV app, and that's from Maron. Hi, Dr. Constant. I don't know about yours, but my kids are completely hooked on their phones, computers, and streamers. I wouldn't be surprised if all these screens are as addictive as smoking or drinking. With school right around the corner, we'd like to know, what are the effects of screen time on a child's development and learning? Well, that's a great question, and it's really tough during the summer because I know that almost everybody has defaulted to the TV or tablet since our children are home and they have a lot of time on their hands. And even though they're going to camp and they're playing outside and they're really getting more physical activity than they would during the school year, there's still so many hours in the day. So what I would say is that number 1, you're not really affecting your child's learning by having them on a device. As a matter of fact, a lot of the devices now are used for academics, and there are a lot of educational materials that you can access on a device. But what you are doing is you're minimizing the physical activity. You are negatively affecting their vision. Studies have shown that more exposure to devices, especially in the home with dark lighting, has had a negative effect on vision, and children have become more myopic than they have in the past years. And so it's very important to have your child exposed to natural light outdoors rather than watching TV or reading on a device. And also it inhibits their social interaction. You know, our children are developing and they're learning how to socialize, and they're learning social development, and constantly being on a device and zoning out onto the TV or being alone in your room playing video games is counterproductive to your social development. I will say that. Also, yes, devices can be addictive. And if you're addicted to your device, then you're likely not reading a novel or working on your academic skills, or you're skipping out on homework. So those also have a negative effect on your overall academic outcome. Okay, so let's see if we have any other questions about back to school. Gustavo sends us a question. Hey doc, our kids are good kids, but they seem to be allergic to homework, which is kind of local. My wife and I are both working on our doctorates, so the kids know how important education is to us. So what can we do to set them up for success? Well, Gustavo, that is a great question, and homework is so difficult nowadays. You know, our kids work so hard at school and they have such a long day, and some even have activities after school. So it's really difficult because the last thing that they want to do when they come home is have to sit behind the desk and do more work. And I understand that, and we have to sympathize with them, but we also have to explain to them that there are certain requirements that they're expected to fulfill while they're in school, and that is completing their homework and making sure that they're prepared for the very next day. And if homework counts and you don't turn it in and they get a low grade, then that is going to negatively affect their overall grades during the year. So we need to explain the importance of homework and the fact that homework was actually created so that they can practice what they learn during the day. If they understand this is not a punishment, this is actually a way for you to solidify what was taught to you and to practice what you've learned, then hopefully they would understand the importance. And honestly, sometimes I personally practice in my home tough love. I've explained the importance of homework. I let my children know why it is important to make sure you turn in your assignments. It's responsibility. It's being accountable for your grades and for your academic progress. But if those things are all understood and you still don't complete your homework and you get a 0, then I think that your child needs to suffer with that bad grade until they realize that maybe they need to get it together and do their homework. So as parents, we need to figure out there's a fine line between encouraging them, supporting them, and then being accountable rather than them being accountable for themselves. There's only so much you can do as a parent. You can educate them, you can let them know how important it is, but after a while, if they truly don't want to do their work, or you're pulling teeth, or you're wasting your whole evening fighting with them just to do a page of homework, you need to maybe pull back a little bit and let them suffer the consequences and learn on their own. Hopefully, it'll just take one time. So good luck with the homework. Okay, it looks like we have another question coming in from Facebook. Lilith. Dr. Constant, my darling daughter Lexi just turned 12 and hasn't had her period yet. My fear is that the first time it happens will be while she's back at school. How can I prepare her? Okay, Lilith, this is everybody's fear, of course, and Murphy's Law says it'll happen while she's in class. So here are a few bullet points for you on how to talk to your daughter about possibly getting her first menstrual cycle, and just a couple of tips on how to prepare her. So the first thing is you absolutely have to have the talk with her. I think that a lot of schools right now have kind of cut out the human growth and development talk at school in science class, and they've kind of left it up to the families to discuss. So it is really important for us as parents to discuss with our children the natural changes that occur in the human body, male and female. I think it's important not only for the females to understand what's going on with their own body, but for them to understand what's happening with the opposite sex as well. You want to understand why your peers are behaving a certain way or changing in their look. So I think that, despite the gender of your child, you really need to talk to them about changes across the board in both sexes. I think it's important to talk about the actual menstrual cycle, what it means, why we get it, what the symptoms are, how long it lasts, and it varies amongst different girls. You want to speak about a little bit about the discomfort that they may experience. And again, I do not think that this talk is exclusive to having a young girl. I do think if you have a son, you should explain this to your son as well. He should know what's happening to his friend that's sitting next to him in class. These are important talks to have with your children. As far as preparing your daughter for her actual menstrual period to come, I think it's really important to prepare a little menstrual kit for your daughter and have her put it in her backpack, and she can actually prepare it herself so that she's involved. And a menstrual kit will have usually something like you would pack like a maxi pad or a tampon. That's a personal choice between you and your child and your family. You would want to put like hypoallergenic wipes. Maybe you want to put an extra pair of underwear for her just in case, and you want to have a Ziploc bag ready for anything that she might need to dispose of, and then you want to put that in a little kit and have her put it in her backpack and just always have it there in case of an emergency. That'll make her feel more comfortable that if anything happens that she is prepared, and also it just makes her also feel a little bit more in control of what's going on with her body. Okay, well, and then good luck with the talk, and definitely look into the period kit. They actually even have a website now where they sell little kits for girls that are already assembled, so you can look those up online as well. Okay, so it looks like we have another question coming in. These are so many questions. This is great. Salelo says, hi, Dr. Constant. Our 5-year-old son has had a persistent dry cough for a while now. With school starting up soon, we'd like to know what we can do to help prevent him from getting a lung or chest infection. Should we put him on an antibiotic or some other prescription medication? Well, Solelo, I'd like to first start off by saying that a child that has had a cough for more than a week should be seen by their pediatrician. It is not normal to cough for more than a week. That means that maybe something else is going on. There are many reasons for a cough. And especially during the summer, we're going to the pool, we're jumping in the ocean, we have, our kids get runny noses, you could have postnasal drip. Sometimes that's the reason for a chronic cough, so that could be handled very easily. Some children that might have reflux disease, you don't have to have reflux your whole life to have reflux. It could just be over the summer, we eat a lot of junk food, we're kind of out of our routine, we go on vacations, things are very different, and you might have mild symptoms of reflux, which could present as a cough. There are other reasons such as reactive airway disease, which is asthma, allergies. So what I'm saying is that a persistent cough per se is something that you should evaluate with a pediatrician and make sure that it isn't something more serious. And as far as a lung infection or pneumonia, pneumonia is very worrisome in the pediatric population. We're always concerned about that. The signs of pneumonia would be a fever, lethargy, abdominal pain, reproductive cough, and difficulty breathing. If those symptoms occur in your child and your doctor's office is closed, then you want to go to the urgent care or the ER right away. And hopefully if your pediatric office is open, you would see your pediatrician right away. It is something that can be managed in the office rather than the hospital. But those are the signs of pneumonia, and those are very serious. So I would absolutely make sure you look into these symptoms, and if there is a further concern, contact your pediatrician. Okay, so it looks like we have another question coming in from Daniela. What are some of the signs that a child may be experiencing learning difficulties? I'm asking because my daughter has been acting both sullen and frustrated lately, and I'm wondering if she's having problems at school, excuse me. But Daniela, I'm very sorry to hear that. And that's a really great question because, academic difficulties can present in many ways. It doesn't necessarily need to present with slipping grades. Some children are able to maintain a pretty decent grade or pass a test even though they are struggling. So I think it is important that I am very happy that you are noticing that your child is acting different and is a bit sullen. And I think the most important thing, first and foremost, is to talk to your child and ask if they're having any difficulties at school, or maybe if they just don't like being in class, or if they feel uncomfortable, if they have any specific feelings toward their teacher, and if they are happy in their environment and they're happy with their classmates and the teacher, and maybe they're expressing that maybe classwork might be a little too difficult for them or they feel behind, then the next thing you want to do is meet with the teacher. And it's also great to have open communication with the teacher because maybe the teacher notices some things that you don't necessarily notice at home. So aside from speaking to your child, I think it's always very important to have open dialogue with your teacher. Our teachers spend more time with our children during the day than we do, so they can be a very valuable source of information. So I wish you luck with that, and make sure you speak to your teacher and have a talk with your child. Okay, so looks like we don't have enough time for any more questions, but I'm happy to answer on the next show. I hope that this helps. I hope everybody's getting ready to go back to school. You're making your appointments with your pediatrician for your physical exams, and you're reviewing your child's vaccination records so that you can start off school on the right foot. Good luck, everyone, and have a great next semester. Take care.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.